Forest Institute for Regenerative Medicine is one of the participants in the Armed Forces Institute for Regenerative Medicine program. And as such, a lot of the projects that we do here at our institute are also related in some manner to the work that we're doing for our wounded warriors. The work of AFIRM is so important for our wounded warriors, and we are totally dedicated to making sure that these regenerative medicine technologies are able to reach that segment of our population. Here at WFPC, we're working on many different projects that have potential advantage to AFIRM, and that includes projects such as skin, where we're actually printing skin that will benefit patients in the future. We're working on, for example, engineering muscle strips, where we can use these muscle constructs to augment functionality of tissues and organs in patients wherever muscle may be present, which is a lot of different parts of your body. And we're also working on many other things, for example, looking at how to generate materials that will provide better viability, better survival at the time of injury, using oxygen delivery, for example. We are working on over 30 different tissues and organs here at the Institute, and really all of these projects have in some way some related benefit to our AFIRM program.
What our goal is to actually develop a bioprinter that can deposit cells within a wound to enhance or increase the healing rate of that wound. And what we'd like to do is develop protocols that we can very rapidly add mature skin cells to the wound that will begin the healing process and hopefully shorten the whole process of burn injury wound healing. Well, what we have is our experimental bioprinter that was designed and built at WFPC, and it consists of a number of different components. And one of those components is our scanner that we can use to scan the wound area. That information is then fed into the computer, which then takes that information, integrates it, and then feeds it back to the printer. And then here is the print head that will contain all of the cell solutions that are needed, and then that is printed directly into the wound bed.
A muscle, in fact, has an incredible regenerative capacity, but some of the devastating wounds caused by the high-velocity projectiles in the combat arena create an extent of muscle damage that cannot be effectively repaired by the body itself. There's not a lot of treatment options for these devastating wounds because they involve such a large amount of muscle. Soldiers have to undergo numerous surgeries, sometimes dozens of surgeries, and they never get full cosmesis or functional restoration. The goal of this is to develop a muscle repair technology that would be completely autologous, that would enhance the endogenous repair mechanism, and as ancillary technologies are developed in parallel to create volume of muscle large enough at implantation that it can correct many of the deficits right off the bat. The technique that we've come up with for these large injuries is to basically take a scaffold, seed it with muscle progenitor cells, and then as you can see in the bioreactor here, what we're doing is we're actually stretching the scaffolds that contain the muscle cells.
My name is Benjamin Harrison. I'm an assistant professor of regenerative medicine. So what we're trying to do is develop what are called particulate oxygen generators, or POGs. And the reason that we're doing this is we're trying to give medical practitioners and tissue engineers a tool that allow them to deliver oxygen to the part of the body that needs it. So we need oxygen to survive. In fact, without it, we can only survive for a few minutes. Now, if we do get some oxygen but not enough, our bodies don't function properly. For example, they don't heal correctly. And that's because virtually every process in our body requires some oxygen. Now, the way that we get oxygen into our bodies is that through our lungs we breathe in the air, and then it gets transported along blood vessels to all the cells in our body. But if those blood vessels, that network of blood vessels, is damaged or destroyed or is non-existent, well, then what do? Well, that's where the POG technology comes in. It really gives us the means to be able to deliver oxygen right where we need it. What we've done so far is that we've made materials that can actually generate the oxygen, We have been able to put this onto cells, and we've been able to show that those cells can survive even when they don't have normally enough oxygen to survive. We've also preclinically seen how the POGs can improve in wound healing and how they can improve the outcomes of skin flaps. We've even begun a clinical trial to see how effective the POGs can be for wound healing.
We take the best, truly some of the best people working in the field, coming together, focused on bringing these technologies to our wounded warriors has been a major advantage of this effort.